bipartisan deal to revive the lapsed Affordable Care Act subsidies remains uncertain this morning after Senate lawmakers left Washington for a one-week break, sounding pessimistic about negotiations. A group of senators has been working to reach a compromise to lower health care costs. But yesterday, some Republican lawmakers did express skepticism they can overcome their biggest differences with Democrats to make a deal. Yesterday, President Trump shared his own health care framework, as the White House is calling it, which calls for redirecting subsidies into individual health savings accounts that people could use to purchase coverage directly. Let's bring in MS Now medical analyst, Dr. Vin Gupta. Dr. Gupta, always great to see you. So obviously the White House is aware of the frustration, the anger, and the struggle that people are having now that the Obamacare subsidies were allowed to expire by this Congress. Put that together with last year's Medicaid cuts. People are struggling. So trying to present some version of a plan, or at least to show that they're trying to present a plan. You've looked through this framework. What do you see?
Willie, good morning. We did. And this is being marketed as bold and transformative. But, you know, when you look underneath the hood, there is serious gaps in terms of this being more than just a framework or a set of talking points. And I think that's take home number one. It's a vision, but it's not an operable plan. And, you know, to give some credit, there are some ideas here that are popular. Capping drug costs, price transparency, which has been talked about, Willie, for decades. But there is no clear explanation, number one, of how coverage would be structured, what minimum guarantees Americans would have to access coverage, and what protections that would exist for people with complex medical needs, pre-existing conditions. And I think that's the take-home number two here is, what is coverage like for those with pre-existing conditions? This was a big centerpiece of the Affordable Care Act that's dominated American healthcare over the last 15 years, at least for those on the fringes of getting a healthcare access, Willie, and reliant on these exchanges. Over 130 million Americans have a pre-existing condition. There is nothing in this plan, granted it's 2 pages, pretty much an outline form, that says what's going to happen to these individuals. If insurers have the ability to not cover pre-existing conditions, Willie, they won't. And then they will offer cheaper plans that younger, healthier people will gravitate towards, leaving older people or those with pre-existing conditions with higher premiums. That's exactly what's going to happen. So those are the concerns.
So short on specifics, to say the least. Dr. Gupta, talk to us about these like direct payments, though, something that sounds sort of good in theory, but walk us through what you feel could be some of the risks involved.
Exactly. You know, sending payments to people is great marketing, but it's not going to stabilize insurance markets. Jonathan, you and I have had this conversation a few times now, and it keeps coming up in these plans that somehow directed payments to individuals is going to be the centerpiece instead of enhancing subsidies or stabilizing access to actual insurance. And here's why it matters. Regardless of the check size, I've seen anywhere from, say, a few $1,000s on up to Americans. We know that barely covers a deductible, even a fraction of a deductible, which can be upwards of 5 figures for families reliant on basic health care. So it doesn't keep up with inflation. It doesn't keep up with the costs of a hospitalization, specialty drug costs. So this concept of directed payments to individuals versus, say, going to the insurer, which is what they keep talking about, it does not substitute, Jonathan, for actual healthcare insurance and fixing the subsidy issue that they, clearly were skirting around. That's one. Number two, this has already been studied. For your audience out there, this has already been studied time and again. People that are reliant on the Affordable Care Act right now, that are now saying that they can't afford these hikes in the premiums, time and again, they tend to earn less than $100,000 as a family. They are not those that utilize healthcare savings accounts, that we use the money that's given to them for basic living needs. They were not going to save it in a healthcare savings account. So this has proven in the past to not work.
This is not a new idea, as you point out, and it might just be a signal rather than an actual plan that they care about healthcare, even though Republicans and others in Congress have let these subsidies expire. MS Now medical analyst Dr. Vin Gupta. Dr. Gupta, thanks for taking such a close look at it. We appreciate it.